Hey everybody, Jeff Kehler back again. Today I've got a training tip for you. IT band syndrome, very common among cyclists and runners. It can aggravate your legs. It tends to manifest itself as a popping sensation or a pain on the outside of your knee here. The IT band is actually a band that starts up in your hip here and runs right down past the outside of your knee. It's kind of like a bungee cord. It's always pulled nice and tight. It's stretched right out, and when it's too tight, you'll feel it popping back and forth across the side of your knee here as your knee flexes, whether it's pedaling or running. It can be fairly painful, quite aggravating, and if not treated, it tends to just get worse. Important thing about IT band syndrome is it's almost misnamed because it's not actually the IT band that's causing the problem. It's the indicator that there's a problem. But the cause is actually this tiny little muscle up top. It's called your TFL. That's short for tensor fasciae lata. But basically, tiny little muscle runs from your hip down into your thigh here. It attaches to the top of the IT band. The easiest way to find it, if you feel your hip bones, go down about an inch and just try rocking your hips back and forth with your feet a little wider than shoulder width. And you'll feel this little muscle firing here from side to side. That's your TFL. So it helps lift your leg up to the side, it helps stabilize your hip. When cycling, if your seat is too high, which is a prime cause for IT band syndrome, it's what is stretched out as you overreach through the hip and then is responsible for bringing the hip back into place there. Now, like I said, it attaches into the top of the IT band, so as that muscle gets too tight, it pulls this bungee cord even tighter, and that's why it starts popping along on the outside of your knee, on your hip, and causes all that pain. So a lot of people use a foam roller to treat IT band syndrome, but what they'll often end up doing is getting onto their IT band syndrome, onto their IT band, because that's what's hurting them, and they just roll back and forth, grinding away on this already tight bungee cord. You're not actually releasing anything. Again, it's not a contractile tissue. It can't flex and pull tight and release like a muscle can. It's just stretched. The TFL up top, that is what can contract, that's what can release, that's what you want to treat in order to relieve the tension, or the excess tension in your IT band. So we will use a foam roller, but we're not just going to grind back and forth along the sore area. That's just going to trigger more pain receptors, cause more aggravation, and it's not really going to treat anything. So we find our TFL there. We're just going to get down on the foam roller, right on top of the TFL. I'm actually going to lift my foot on the back, and I'm just going to roll around. Remember, it's a small muscle. It's only about this long. We're going to find the point where it hurts the most. That's your trigger point. We're just going to rest. We're going to hunker in here. We're going to keep all the weight, as much weight as we can on that spot. Yes, it's going to hurt as much as you can tolerate. You really want it to hurt a fair bit here, because what we're doing is we're squishing this tense ball in the muscle between the foam roller and our hard bone and causing it to release. We're squeezing it out. So we're going to stay on that point for 30 seconds, up to 2 minutes. You're going to feel a release in the muscle. I've already felt it with this one. Not bad idea to rock around, see if there's any other trigger points there. Again, you just settle in on it, ride it out. Breathe, don't forget to breathe. And within 30 seconds to 2 minutes, it's going to pass. You can do the other side, and that is going to be a far more beneficial treatment for the tension, and it's going to help return some comfort to your riding or your running. Side note though, cyclists, if you're having problems with this, 99% of the time there's a fit issue, and you should see somebody who can help you with your bike fit. Your seat probably has to go down, it may have to go forward, but it's important that you address that, otherwise it's just going to be a recurring issue. Thank you.